entitled the top causes and risk factors of blood clots. Blood clots naturally are formed by the body when there is a damage to our blood vessels or any tissue, either on the skin or within the body. So it's very, very natural for the body to produce these blood clots to solve a problem. But when this problem is solved, afterwards, the body will break the clots down or dissolve them, and so the individual will not even experience any symptoms at all. But unfortunately, there are certain conditions that can promote or that can cause blood clots. Such unnecessary or unwanted blood clots can produce symptoms. And some of these symptoms are the following. If there's a clot that is formed in the deep vein in your legs or in your hip, but mostly in the legs, that individual suddenly, the affected leg will be swollen, especially in the calf area, and it will feel warm, and there's a discoloration. Okay, that is it. And when the clot is formed towards your lungs or in your lungs, it's called pulmonary embolism. So the individual will suddenly experience shortness of breath, severe one, and chest pain. The person may feel the pain even more when he or she coughs or is breathing. And there's also, the person may experience rapid heart rate. It's called tachycardia. And that individual may also cough out blood and feel dizzy. And that is pulmonary embolism. Okay. These symptoms, when you experience it, is a matter of emergency. The third symptom is arterial thrombosis. What does it mean? It's a blood clot in the artery, which can lead to conditions like heart attack or stroke. When there's a clot problem, also leading, that is when there's a clot issue in the renal vein, it's called a renal vein thrombosis. What does it mean? It's a clot in the vein that drains blood from your kidneys. So if there's a clot there, you may experience what they call flank pain. It's pain in the side and your back. And normally that individual may also see a little bit blood in the urine. And there is also sudden kidney malfunction, and that will be noticed as high blood pressure or swelling of the legs. There's another symptom that we should pay attention to, that is portal vein thrombosis. What does it mean here? It's clot in the portal vein. What is the portal vein? The portal vein carries blood from the digestive system to your liver. Okay, for the liver is the distributor of these nutrients, is the manager of the body. So when there's a clot, the individual may experience abdominal pain, swelling of the abdomen. It's called ascites, and then enlarged spleen. Actually, so that is another common symptom. Individual also may see some blood in their stool. So let's take note of all these. All these symptoms are a matter of emergency that you have to call for this clots to be addressed. But then after that, it's important to find out what is the real cause and then to address the root cause, because anytime any individual experience clot once in their life, there is a high risk to experience it again. All right. So what are the key causes of blood clots? Number one, as I was saying, is very natural one, that if there's a damage in the arteries or a damage in the blood vessels, your body will automatically form this clot and try to dissolve, try to repair or heal this damage, if it's on the top of the skin or inside the body, the body tissues. The second possibility of cause is individual going through surgeries. It's a rare trauma for the body, so there's also a cause for clot formation, unnecessary clot formation. So normally people are given there's anticoagulants or blood thinners, okay, but that shouldn't be taken for too long because they also have their own side effects as well. And there's another one cause of clot formation when there's what they call atherosclerosis, meaning plaques in the arteries. Arteries are the blood vessels we carry blood from the heart and distribute to your brain and every organ up to the feet. When we have plaques there and the plaques burst, that can also create clots and that can lead to stroke or heart attack. All right, so that is these are the key causes of blood clots, unwanted blood clots. But what can promote, or what actually are the risk factors? The risk factors are the following. If you are aging, let's say 60 and more, most people may be on medications, and they are also not too mobile. They are not too active. That actually is a risk factor here. And there are few individuals is a inherited or genetic issue, but only 3-5% of these people is blood clotting disorders. That also does exist, but we have what they call atrial fibrillation. Atrial fibrillation is that the top chambers of your heart not beating in unison with the lower chambers. That can also lead to clot formation in the heart that can lead to actually stroke or heart attack as well. Diabetes, cancers in general, chronic inflammation in the body, blood pressure, weight problems, that is being obese, and that if you're a woman, you take birth control pills or you've gone through hormone replacement therapy, there's also a risk for unnecessary blood clots. Inactivity, normally lying for too long in bed, or maybe when you're sitting because of a long journey on a plane, that is also a promoter. Smoking, even if you're a secondary smoker, is also a promoter here. Dehydration, insufficient fluid or water that you take, water intake, can also promote it. Medical devices like catheters or pacemakers put in the body can also promote this. And artificial sweetness when it comes to food and processed food, and unhealthy oils like vegetable or high seeded oil like corn oil can all promote actually blood clots. As you listen to me, you may not have any blood clots issue, but you have maybe underlying health problems that can cause blood clots. One call away and your life will not be the same. Call this number if you're calling outside the UK. It's +44 738 464 7300. If you're calling within the UK, it's 0738 464 7300. If you want to learn more about my videos, you can go to my YouTube channel, put in Dr. James Natural Link, Dr. James Natural Link, and go there, subscribe and support me, and also for the fact that you don't lose future programs. Thank you very much for listening to me today.